strengthen the enforcement of existing regulations and take certain additional measures. In order to reduce the rate of transmission, we had earlier said that the wearing of cloth masks will be mandatory. While many South Africans are wearing masks, there are, however, some amongst us who are not wearing masks when they are in public. It is therefore important that we should enforce the wearing of masks. Regulations on the wearing of masks will be strengthened. Employers, shop owners and managers, public transport operators and managers, and owners of any other public building are now legally obliged to ensure that anyone entering their premises or facilities or vehicle must be wearing a mask. All workplaces and all institutions need to ensure that there is a designated official responsible for making sure that all regulations and all precautions about all this are strictly adhered to. Taxis undertaking long trips will have to adhere to a 70% occupancy, but those who are undertaking local trips will be permitted to increase their capacity to 100%. And this will be on condition that new risk mitigation protocols related to masks, vehicle sanitation, and open windows are followed. As we head towards the peak of infections, it is vital that we do not burden our clinics and hospitals with alcohol-related injuries that could have been avoided. This is a fight to save every life, and we at the same time need to save every bed in our health facilities. We have therefore decided that in order to conserve hospital capacity, in order to make sure that there are sufficient and enough beds in our hospitals that are not taken by those who come in resulting from alcohol-induced trauma or injuries. We've now decided that the sale, the dispensing, and the distribution of alcohol will be suspended with immediate effect. There is now clear evidence that the resumption of alcohol sales has resulted in substantial pressure being put on hospitals, including trauma and ICU units, due to motor vehicle accidents, violence, as well as related trauma that are alcohol-induced.